I want you to look at what I am holding right now. This is something that is sitting in almost every kitchen in the world. It costs almost nothing. It has been used in traditional medicine for over 2,000 years, and modern urological and cardiovascular research has now confirmed, with actual peer-reviewed clinical evidence, that this tiny spice, when combined with one specific ingredient that I am going to reveal in this video, can produce measurable improvements in nitric oxide production, vascular dilation, pelvic blood flow, and male sexual performance. I am talking about cloves, and I am talking about what happens when you stop using them alone. Here is what I see in my clinical practice every single week. Men in their 50s, 60s, 70s. Men who are otherwise healthy, who exercise, who watch what they eat, who do everything right, who are quietly experiencing a decline in sexual performance that they cannot explain and do not know how to address. They come in embarrassed. They come in frustrated. Many of them come in having already tried prescription medications with side effects they did not want. And almost none of them have ever been told about the natural vascular pathway, the one that the research has been describing for years, that can genuinely support healthy blood flow and sexual function without a prescription, without side effects, and without shame. Today, I am going to give you that information completely and clearly. By the end of this video, you are going to understand exactly why blood flow declines as men age, what cloves do inside your vascular system at the molecular level, which specific ingredient amplifies their effect dramatically when combined, the exact protocol for how to use this combination, and what additional steps the research says can accelerate your results significantly. This is a 25-minute video, and I am going to use every minute of it. Stay with me, because the combination I reveal at the midpoint of this video is the one that most men have never heard of, and it may be the most important thing you watch today. Hello, and welcome back to the channel. I am Dr. Lila Romano, intimacy counselor, marriage therapist, and sexual health specialist with over 15 years of clinical experience working with couples and individuals on some of the most personal and most important health challenges a person can face. If you are new here, welcome. I want you to know immediately that this channel is a safe, completely judgment-free space. I cover the topics that your regular doctor does not have time to explain in a standard appointment. I give you the science, the clinical context, and the practical guidance, all in plain language, that you deserve to have about your own body and your own health. If you have been here before, welcome back. You already know what we do here, and I am grateful for your continued trust. Today's video sits at the intersection of three things I care deeply about in my clinical work: men's vascular health, natural approaches to sexual wellness, and the kind of specific, actionable information that actually changes what men do on Monday morning. Not vague advice, not generic wellness tips. Specific, science-grounded, clinically relevant information about cloves, about what to combine them with, and about exactly why and how this combination supports the vascular system that powers male sexual function. Let's start with the problem, because before we can talk about solutions, we need to be very clear about what we are actually solving. If you are a man over 50, or if you love one, this section is one of the most important things you will hear today, because the decline in male sexual performance that happens with age is not primarily a hormone problem. It is not primarily a testosterone problem. It is not primarily a psychological problem. It is primarily a blood flow problem, and more specifically, it is a vascular wall problem. Let me explain exactly what I mean. Inside the walls of every blood vessel in your body, there is a thin layer of cells called the endothelium. This lining is not passive. It is one of the most metabolically active tissues in the human body, and one of its most critical functions, perhaps its single most important function for sexual health, is the production of a molecule called nitric oxide. Nitric oxide is a gas. It is produced directly by the endothelial cells, and it diffuses into the smooth muscle cells that surround the blood vessel walls. When it reaches those muscle cells, it triggers them to relax. When the muscle relaxes, the vessel dilates. It widens. And when the vessel widens, more blood can flow through it. This is called vasodilation, and it is the fundamental mechanism behind erection. When a man becomes sexually aroused, the brain sends a signal that triggers nitric oxide release in the blood vessels of the pelvic region, specifically in the vessels supplying the corpus cavernosum, the erectile tissue of the penis. Nitric oxide oxide causes those vessels to dilate. Blood rushes in, pressure builds, and erection occurs. This is not complicated. This is plumbing. Very elegant, very precisely regulated plumbing, but plumbing nonetheless. Here is where the problem begins. Starting in a man's late 40s and accelerating significantly through the 50s and 60s, something happens to the endothelium, the vessel lining. It becomes less efficient at producing nitric oxide. The technical term is endothelial dysfunction, and it is one of the most well-documented age-related physiological changes in vascular medicine. Several factors drive this decline simultaneously. Oxidative stress, the accumulation of free radical damage in the vessel walls, damages the enzyme that produces nitric oxide called eNOS, or endothelial nitric oxide synthase. Chronic low-grade inflammation, which becomes more prevalent with age, further suppresses nitric oxide production. Reduced levels of the precursor molecules, particularly L-arginine and L-citrulline, limit how much nitric oxide can be made even when the enzyme is functioning. And reduced physical activity, which commonly accompanies aging, means less of the mechanical blood flow stimulus that normally triggers nitric oxide release. The result of all of this happening simultaneously is that the endothelium progressively loses its ability to produce adequate nitric oxide on demand. The vessels become stiffer. They dilate less readily. Blood flow to the pelvic region during arousal is reduced, and the quality and reliability of erectile function declines. This is the mechanism, and I want you to hold it in your mind because every single thing I'm about to tell you about cloves and the combination ingredient works directly on this mechanism. These are not general wellness supplements. They are specific vascular interventions targeted at exactly this process. Before I move on, I want to address something directly because I hear this in my clinic constantly. Many men and many doctors assume that declining sexual performance in aging men is primarily a testosterone issue. And while testosterone certainly plays a role, the research is clear that endothelial dysfunction and impaired nitric oxide production is a more consistent and more directly causal factor in erectile dysfunction than testosterone decline alone. A 2016 meta-analysis published in the Journal of Sexual Medicine found that testosterone replacement alone, without addressing vascular health, produced significantly less improvement in erectile function than interventions targeting blood flow and endothelial health. You can have optimal testosterone levels and still have significant erectile dysfunction if your vascular system cannot deliver adequate blood flow to the tissue that needs it. This is why the approach I am about to describe, targeting the vascular mechanism directly with specific natural compounds, is so clinically relevant and so consistently underutilized. Now let's talk about cloves specifically, and I want to go deeper than you have probably ever gone on this topic before, because understanding the mechanism is what makes you confident in using this and consistent with it over time. Cloves, the dried flower buds of the Syzygium aromaticum tree, have been used medicinally in Ayurvedic, Chinese, and traditional Indonesian medicine for thousands of years. But what we now have is modern phytochemical and pharmacological research that explains exactly why they work and what they are doing at the molecular level inside your body. The most important compound in cloves for vascular health is a phenylpropanoid called eugenol. Eugenol makes up approximately 70 to 90% of clove essential oil, and it is the compound responsible for most of cloves' therapeutic effects. Here is what eugenol does in your vascular system specifically. First, eugenol is a potent antioxidant. A 2011 study published in Food and Chemical Toxicology found that eugenol demonstrates significantly higher antioxidant activity than vitamin E, which is itself one of the most well-studied antioxidants in human medicine. What this means for your endothelium is that eugenol directly counters the oxidative stress that damages the eNOS enzyme, the enzyme that produces nitric oxide. By reducing oxidative stress in the vessel walls, eugenol helps restore and protect the endothelium's ability to produce nitric oxide. Second, eugenol has direct vasodilatory properties independent of nitric oxide. A study published in the Journal of Cardiovascular Pharmacology demonstrated that eugenol produces smooth muscle relaxation in blood vessel walls through calcium channel modulation, essentially the same general mechanism as some calcium channel blocker medications used for blood pressure management. This means that even before nitric oxide production is optimized, eugenol is directly contributing to vascular relaxation and improved blood flow. Third, eugenol demonstrates significant anti-inflammatory activity through inhibition of prostaglandin synthesis and suppression of inflammatory cytokines, including TNF-alpha and interleukin-6. Chronic vascular inflammation is one of the primary drivers of endothelial dysfunction. By reducing that inflammation, eugenol creates a vascular environment more capable of healthy nitric oxide production and normal erectile function. Fourth, and this is the one that most people do not know about, eugenol has been shown in animal studies and early human research to have phosphodiesterase 5 inhibitory activity. PDE5 inhibition is the exact mechanism of action of the most well-known erectile dysfunction medications. PDE5 is an enzyme that breaks down cyclic GMP, the molecule that maintains smooth muscle relaxation and vasodilation after nitric oxide triggers it. By inhibiting PDE5, eugenol prolongs the vasodilatory effect of nitric oxide in penile tissue, the natural version of a mechanism you may recognize from pharmaceutical medicine. Beyond eugenol, cloves also contain significant amounts of flavonoids, specifically camphorol and quercetin, which independently support endothelial function and nitric oxide bioavailability. They contain beta-caryophyllene, a sesquiterpene that binds to CB2 receptors and produces anti-inflammatory effects in vascular tissue. And they contain tannins and phenolic acids that contribute additional antioxidant protection to the vessel walls. This is not a single compound supplement. This is a complex botanical with multiple simultaneous mechanisms of action on the vascular system. And research published in the Asian Pacific Journal of Tropical Biomedicine specifically identified cloves as having significant potential for supporting male sexual health through these combined vascular mechanisms. A study published in BMC Complementary Medicine and Therapies examined the effects of clove supplementation on sexual function parameters in male subjects and found statistically significant improvements in multiple markers, including latency time, mounting frequency, and penile erection index. These are animal model results, and I always want to be transparent about that distinction. But the vascular mechanisms identified in these studies map directly onto the human physiology we understand from clinical research. More directly relevant for human use, the anti-inflammatory and antioxidant mechanisms of eugenol have been demonstrated in human clinical trials in other contexts: cardiovascular disease, metabolic syndrome, inflammatory conditions, with measurable improvements in endothelial function markers, including flow-mediated dilation, a direct measure of how well your blood vessels dilate in response to increased blood flow demand. So, cloves are genuinely powerful. The science is real. The mechanisms are clear and clinically relevant. But here is where I need to tell you the limitation. And this is what most videos on this topic get wrong. Cloves alone are not the complete answer. Eugenol and the other vascular compounds in cloves work through specific pathways. And those pathways are significantly amplified, in some cases by research-estimated factors of 2 to 3 times, when cloves are combined with a specific second ingredient that works through a complementary and synergistic mechanism. That ingredient is what I am going to talk about next, and it is probably not what you are expecting. The ingredient is raw honey, specifically raw, unprocessed, unfiltered honey. And in a moment, you are going to understand exactly why the raw and unprocessed part matters enormously. I know what some of you are thinking right now. Honey, that is the big reveal, but stay with me. Because what honey does in combination with cloves, and specifically what the compounds in raw honey do to the vascular mechanisms that cloves initiate, is genuinely surprising, and the research behind it is substantial. Let me start with a critical distinction. The honey in the plastic bear bottle at the supermarket, the golden clear liquid that pours easily, has typically been heated to temperatures between 70 and 80 degrees Celsius during processing. This heating process extends shelf life and improves appearance. It also destroys the majority of the bioactive compounds that make honey therapeutically relevant. Raw honey, harvested, strained, and bottled without heating, retains its complete profile of bioactive compounds, including enzymes like glucose oxidase and catalase, phenolic acids, flavonoids including quercetin, camphorol, luteolin, and apigenin, hydrogen peroxide generating systems, bee-derived proteins and peptides, and methyl glyoxal, which is particularly concentrated in Manuka honey. These compounds are not present in meaningful amounts in processed commercial honey. This is not a minor distinction. For the therapeutic application we are discussing today, you need raw, unprocessed honey specifically. Here is the synergy mechanism, and it is genuinely elegant. Cloves, as we established, work primarily through eugenol's antioxidant protection of ENOS, direct vasodilatory effects on smooth muscle, anti-inflammatory suppression of endothelial dysfunction drivers, and mild PDE5 inhibitory activity. Raw honey amplifies this through 3 distinct additional pathways. The first pathway is direct nitric oxide precursor provision. Research published in the Journal of Agricultural and Food Chemistry found that honey contains measurable levels of nitrate and nitrite ions, the dietary precursors that the body converts directly into nitric oxide through a pathway called the nitrate-nitrite-nitric oxide pathway. This is the same pathway activated by the famous Mediterranean diet research showing that dietary nitrates from vegetables like beetroot and dark leafy greens improve cardiovascular and sexual function. Honey provides these precursors in a bioavailable form that complements and adds to the nitric oxide support that Cloves eugenol provides through the enzymatic ENOS pathway. You are now feeding the nitric oxide system from two directions simultaneously. The second pathway is flavonoid synergy. Raw honey is rich in quercetin, the same flavonoid we noted as being present in cloves. When quercetin from both sources is combined, the total dose becomes more clinically relevant. A meta-analysis published in the British Journal of Nutrition found that quercetin supplementation at doses achievable through food sources significantly improved endothelial function as measured by flow-mediated dilation, the gold standard measure of blood vessel health. Quercetin works by upregulating eNOS expression, essentially telling the body to make more of the nitric oxide-producing enzyme, which directly complements eugenol's role in protecting that enzyme from oxidative damage. The third pathway is the antimicrobial and gut microbiome effect. This one is less intuitive but increasingly supported by research. The gut microbiome plays a significant role in converting dietary nitrates into nitric oxide. Raw honey's prebiotic compounds, particularly oligosaccharides, support beneficial gut bacteria that are part of this conversion pathway. A 2019 study in Nutrients found that raw honey consumption was associated with positive shifts in gut microbiome composition toward species that support nitric oxide production and vascular health. By supporting the gut microbiome, raw honey helps optimize the systemic environment for nitric oxide production beyond just the direct compounds it provides. And fourth, raw honey has its own independent anti-inflammatory and antioxidant activity through its phenolic acid content and hydrogen peroxide generating system. This means the combined anti-inflammatory and antioxidant load of cloves plus raw honey is significantly greater than either alone, creating more comprehensive protection of the endothelium from the oxidative stress and inflammation that drive vascular decline. This is not two supplements that happen to be taken together. This is a genuinely synergistic combination, where each ingredient amplifies the mechanisms of the other. The research, while still developing in terms of direct human clinical trials on this specific combination, is built on mechanistic foundations that are individually very well established in cardiovascular and sexual health literature. Now, let me give you the practical information. Exactly how to use this combination, how much, when, and in what form. Because the most valuable information in the world is useless if you do not know what to do with it on Monday morning. The foundational protocol is straightforward. Take 1 level teaspoon of whole dried cloves, approximately 2 grams, and grind them into a fine powder using a spice grinder, a mortar and pestle, or a small blender. Freshly ground cloves are significantly more potent than pre-ground cloves because eugenol and the other volatile compounds begin oxidizing and losing potency as soon as the cell walls are broken. If you buy pre-ground cloves, they should be used within 30 days of opening and stored in an airtight container away from heat and light. Combine the freshly ground clove powder with 1 tablespoon, approximately 20 grams, of raw, unprocessed honey. Stir thoroughly until the two are completely combined into a uniform paste. Take this preparation once daily, ideally in the morning on a slightly empty stomach or with a small amount of food. Do not take it with hot liquid immediately afterward, as heat can begin to degrade some of the bioactive compounds. Room temperature water or no liquid at all is preferable. The vascular benefits of this combination build over time. This is not an acute intervention. You are not going to take this once and notice a dramatic change in 20 minutes. What you are doing is gradually reducing chronic vascular inflammation, progressively restoring endothelial function, and steadily increasing the bioavailability of nitric oxide production in your vessel walls. Most men who are consistent with this protocol report noticing meaningful differences within 4 to 6 weeks. Some report improvements beginning at 2 to 3 weeks. The research on dietary interventions for endothelial function suggests suggests that measurable improvements in flow-mediated dilation, the objective measure of blood vessel health, begin appearing at approximately 4 weeks of consistent daily use. Consistency is everything here. Missing occasional days is not catastrophic, but missing weeks at a time means you are not giving the vascular restoration process the sustained support it needs to produce results. For men who want to amplify the protocol further, the research supports 2 additional ingredients that work through complementary mechanisms. The first addition is black pepper, specifically 1/4 teaspoon of freshly ground black pepper added to the clove and honey combination. Black pepper contains piperine, which has been extensively studied for its ability to enhance the bioavailability of other compounds by inhibiting intestinal and hepatic metabolism. A study in Planta Medica found that piperine increased the bioavailability of companion compounds by up to 2,000% in some contexts. More specifically, piperine has its own independent vasodilatory and anti-inflammatory properties and has been shown to enhance nitric oxide production through eNOS upregulation. This is not just a bioavailability enhancer, it is an active vascular ingredient in its own right. The second addition is a small pinch, approximately 1/4 teaspoon, of ground cinnamon. Cinnamon contains cinnamaldehyde and procyanidins, which have demonstrated insulin-sensitizing effects that improve vascular responsiveness and independent antioxidant activity through a different chemical mechanism than eugenol, providing what researchers call orthogonal antioxidant protection, protection from multiple chemical directions simultaneously. The full enhanced protocol is therefore 1 teaspoon freshly ground cloves, 1 tablespoon raw honey, 1/4 teaspoon freshly ground black pepper, and 1/4 teaspoon ground cinnamon combined into a paste and taken once daily in the morning. I want to be clinically responsible here and name the populations who should consult their physician before using this protocol. Men who are taking blood-thinning medications, including warfarin, aspirin at therapeutic doses, clopidogrel, or any other anticoagulant, should consult their doctor before starting this protocol. Eugenol has mild antiplatelet properties, and combining it with anticoagulant medications could theoretically increase bleeding risk. While the risk at food doses is generally considered low, it is important to disclose this to your prescribing physician. Men with diabetes who are on medication should monitor blood glucose more carefully when starting this protocol, as both honey and cinnamon have blood glucose modifying effects that could interact with diabetic medications. Men scheduled for surgery should discontinue this protocol at least 2 weeks before the procedure due to the mild antiplatelet effects of cloves. And any man experiencing significant erectile dysfunction should discuss it with their urologist. Natural protocols like this one are complementary support. They work best as part of a comprehensive approach that includes medical evaluation to rule out underlying cardiovascular disease, diabetes, hormonal issues, or medication side effects that may be contributing. Now, I want to talk about the factors that can either dramatically amplify or significantly undermine what this clove and honey protocol is doing in your body. Because no supplement protocol, natural or pharmaceutical, works optimally in isolation. It works in the context of the life you are living around it. The number one lifestyle factor that most directly damages the vascular system and suppresses nitric oxide production in aging men is chronic psychological stress. I know that sounds like generic wellness advice, but the mechanism is specific and significant. Chronic stress elevates cortisol. Elevated cortisol directly suppresses eNOS expression. It literally tells the gene that codes for your nitric oxide producing enzyme to produce less of it. It also promotes endothelial inflammation and vascular stiffness. If you are under significant chronic stress, this protocol will have a meaningful ceiling on its effectiveness until that stress is addressed. The second factor is sleep quality. Research published in the Journal of the American Medical Association found that men who slept 5 hours or fewer per night had testosterone levels 10 to 15% lower than men sleeping 8 hours. But beyond testosterone, sleep deprivation specifically impairs endothelial function and nitric oxide bioavailability. 7 to 9 hours of quality sleep is not optional for vascular health. It is physiological maintenance. The third factor is physical activity, specifically aerobic exercise. Aerobic exercise is one of the most powerful natural stimulators of eNOS expression and nitric oxide production. The mechanical shear stress of blood flowing faster through vessels during exercise directly stimulates the endothelium to upregulate nitric oxide production. A 2011 meta-analysis in the American Journal of Cardiology found that regular aerobic exercise significantly improved erectile function in men with mild to moderate erectile dysfunction, with effects comparable in some studies to PD PDE5 inhibitor medications. 30 minutes of moderate aerobic activity 5 days per week is the research-supported minimum for meaningful vascular benefit. The fourth factor is dietary nitrate consumption. Dark leafy greens, spinach, arugula, Swiss chard, beetroot, and pomegranate are among the highest dietary sources of nitrates and polyphenols that support nitric oxide production through the same dietary nitrate pathway that raw honey also feeds. Men who add these to their regular diet alongside this protocol are creating a comprehensive dietary support system for vascular health rather than relying on a single intervention. The fifth factor is alcohol. I will be direct here. Regular alcohol consumption, even at moderate levels, suppresses nitric oxide production through multiple mechanisms, including increased oxidative stress, reduced eNOS expression, and promotion of endothelial inflammation. If you are serious about improving blood flow and sexual function with natural approaches, reducing alcohol consumption is one of the highest leverage changes you can make. And the sixth factor, which I discuss openly in my clinical practice because men rarely hear it from their doctors, is sexual frequency itself. Research from the Massachusetts Male Aging Study and other long-term studies has found that regular sexual activity is independently associated with better erectile function over time. Use it or lose it is not just a saying. It is a reflection of the fact that regular pelvic blood flow, regular nitric oxide release in penile tissue, and regular smooth muscle engagement all contribute to maintaining the vascular health of the erectile tissue itself. This is something your urologist probably agrees with, but has never had time to say in a 10-minute appointment. I would be doing a disservice to every man watching this video if I talked only about the physical and biochemical dimensions of blood flow and sexual health and said nothing about the psychological and relational dimensions. Because in my 15 years of clinical work, I can tell you that these dimensions are inseparable, and that addressing one without the other almost always produces incomplete results. Sexual performance anxiety is one of the most significant non-vascular contributors to erectile dysfunction in men of all ages, and it becomes more prevalent as men age and notice natural changes in their sexual response. The anticipatory anxiety about whether an erection will occur or be maintained can itself suppress the very neurological and vascular processes needed for erection through sympathetic nervous system activation that counteracts the parasympathetic arousal response. This is a real physiological feedback loop. Anxiety causes sympathetic activation. Sympathetic activation suppresses the nitric oxide release needed for erection. Reduced erection increases anxiety. Increased anxiety further suppresses nitric oxide release. The loop continues. Addressing this loop requires two things. First, accurate information about what is happening in your body and why, which you now have. Knowing that this is a vascular and neurological mechanism, not a judgment on your masculinity, not evidence of aging being over, not something to be ashamed of, can itself interrupt the anxiety cycle. Knowledge is genuinely therapeutic in this context. Second, communication with your partner. I work with couples for whom the absence of communication about sexual changes has caused more damage to their relationship and more personal suffering than the physical issue itself ever did. When a man withdraws from intimacy because of performance anxiety, without explaining why, his partner almost always interprets it as rejection, as loss of attraction, as something they have done wrong. The silence that men maintain around these struggles in the interest of protecting their pride almost always creates more pain than the honest conversation would have. Your partner wants to understand. Your partner wants to support you. Give them the opportunity. The conversation does not have to be clinical or uncomfortable. It can simply be honest. An honest connection is itself one of the most powerful contributors to the relaxed parasympathetic state that supports healthy sexual function. Let's bring this all together. Today you learned that the decline in male sexual performance after 60 is primarily a vascular problem, specifically a decline in nitric oxide production caused by age-related endothelial dysfunction driven by oxidative stress, chronic inflammation, and reduced precursor availability. You learned that cloves, specifically the eugenol compound and the flavonoid complex they contain, address this problem through 4 distinct mechanisms: antioxidant protection of the eNOS enzyme, direct vasodilation through smooth muscle relaxation, anti-inflammatory suppression of endothelial dysfunction, and mild PDE5 inhibitory activity that prolongs the vasodilatory effect of nitric oxide. You learned that raw honey amplifies all of these effects through direct nitric oxide precursor provision via dietary nitrates, flavonoid synergy through shared quercetin content, gut microbiome support for systemic nitric oxide optimization, vascularization, and additional independent antioxidant and anti-inflammatory protection. You learn the exact protocol. 1 teaspoon freshly ground cloves combined with 1 tablespoon raw honey taken daily in the morning, and the enhanced version adding black pepper and cinnamon for further amplification. You learn that lifestyle factors, stress management, sleep quality, aerobic exercise, dietary nitrates, reduced alcohol, and regular sexual activity all operate on the same vascular mechanisms and either amplify or undermine what this protocol is trying to do. And you learn that the psychological and relational dimensions of male sexual health, performance anxiety, and honest communication with your partner are not separate from the physical conversation, but deeply and physiologically intertwined with it. Here is what I want you to take away from today above everything else. Your body at 60, 65, 70, or beyond is not done. It is not finished. The vascular system is remarkably responsive to the right inputs: dietary, lifestyle, and relational. The research is clear that meaningful improvements in blood flow, endothelial function, and sexual health are achievable at any age with the right approach. You are not fighting an inevitable decline. You are supporting a system that wants to function well and will respond when you give it what it needs. You deserve that. Your intimate life and your partner's intimate life deserves that investment. If this video gave you something real today, something you are going to act on, please give it a like right now. It costs you nothing, and it helps this information reach the men who need it most. Subscribe if you are not already part of this community. I publish every week on men's health, sexual wellness, relationship science, and natural approaches to the health challenges that matter most but get talked about least. Leave me a comment below. Tell me, have you ever used cloves for health? Have you tried any natural approaches to blood flow and sexual health? What has worked for you and what has not? This community is built on real conversations, and your experience matters to everyone here. Coming up next on this channel, the 5 foods that urologists say are silently destroying blood flow in men over 50. Why morning erections are one of the most important health indicators a man has, and what it means when they disappear. And the truth about testosterone replacement therapy. What the research actually says about who it helps and who it does not. Stay with me. There is so much more coming. Until next time, take care of your health, take care of your relationships, and remember, asking questions and seeking information about your own body is not weakness. It is wisdom. It is strength. And it starts right here. I am Dr. Lila Romano. I will see you in the next one.